I also want to say thank you to Hai for sharing his story today, and that's exactly why we are here, to share stories that remind us of why it's so important to fight for health care coverage, which is under attack at the federal level. It's up to the states to fill the void of leadership on this issue. We absolutely must fight to ensure these critical protections remain intact across the United States. Here in Oregon, we've already put consumer protections into state law that will help Oregonians with pre-existing conditions stay covered if it's struck down at the federal level. But we absolutely must do more. Everyone deserves to lead a healthy, productive life, no matter where they call home. Every one of us has a friend or a loved one with a pre-existing condition. It may be cancer, it may be a heart condition, it may be diabetes. Before the ACA guaranteed coverage, if they didn't have a government or strong employer-sponsored insurance, people with these conditions were often uninsurable. In this country, this is absolutely unacceptable. The patients here today can tell you what it means to have treatment. It means chemotherapy. It means surgery. It means a doctor's expertise, and it means access to life-saving medications. Most importantly, it means hope. Right now, the Attorney General and the Trump administration are threatening to rip away that hope, to rip away health care from those who need it the most. From your friends, your neighbors, or your family members. From people like Hai, from people like Shahela, from people like Jacob. Jacob, and he let me share his story today. He's 16 years old. He has a heart condition, and while he has been very fortunate to have the surgery that he needs, and he's able to manage his condition with his doctors, he's going to need to closely monitor his blood pressure and take medication for the rest of his life. Just as his condition impacts daily decisions and holds him back from certain activities like ultramarathoning, it will certainly drive the course of his life. When he ages out of his current health insurance coverage, his job choices, unfortunately, will be driven just as much by benefits as by his vocation. His life decisions will be based on his ability to get health insurance. And while that sounds difficult, it's certainly better than the alternative, which means not being able to get coverage no matter what he does or where he goes. This administration is causing uncertainty and chaos in families' lives across the entire country. Taking away coverage for people with pre-existing conditions will destabilize our state's individual insurance markets and increase costs. Its impacts will ripple into businesses and our economies, and it's certainly a rejection of American voters' voices.